Hi, my name is Dr. Ochuko Ogbon. I am an internal medicine resident and a current member of AMPA. I come from Nigeria. I was born and raised in Warri, which is one of the biggest cities in Delta States. And growing up, it was a really large family, lots of kids, so we had to be really strict and disciplined. This definitely influenced my path towards medicine. If you know Nigeria, it's every parent's dream. But personally, it also became my dream when I had an accident. As a young child, I burnt a part of my body, and just seeing how much care I got in the hospital from the doctors and the nurses, I knew, yes, this is something I wanted to do. I wanted to go further and give this to someone else, be able to care for someone else. And I started my path toward medicine. I trained in the University of Port Harcourt. After training, I wanted to further my education, and we're best to get the excellent education in the United States. So I moved to the United States, and I'm currently doing my residency in internal medicine. I think outside medicine, I still love helping people, so I'm involved in volunteer activities. One thing that I was able to do with a group of other people was set up a foundation geared towards helping the homeless in Dallas area as well as surrounding neighborhoods. And this year I've made it one of my goals to exercise some more, so I'm doing some fitness boxing. I definitely look different when I'm doing the boxing, but yes, that's something that I love to do. But one definite challenge that we face in Nigeria is health illiteracy. It's very, very widespread, right? So we have a lot of people that are not informed at all about best health practices, or even practice like dangerous health habits, thinking that it's beneficial, but then it's actually harming the kid, or it's harming the patients, or harming their friends. We have people that even when they're informed about their health diagnosis, they do not take steps towards curing it, just because there's a lot of disbelief in the system. But I think there's been some growth, there's been some improvement, there's been a lot of campaign. As a medical student, that's also something that I try to do to improve community awareness, and I would say that it's improved, especially with the whole internet, which everyone has access to. So there's been some improvements in health education, but we definitely still have a long way to go, especially in the rural communities and working with the less privileged. So that's one thing I love about, my time here in Nigeria, because I was able to really help people that do not have access to this health care and educate them, inform them about their health, help them make good choices going forward. It's something that I like. A particular experience that I had in medical school, I don't know, none comes to mind right now. International medical graduates, that's also one course that I'm very passionate about, because I was a medical student that was thinking what next to do, and then I made the decision to study abroad. So there are other medical students that would want to make that decision as well, and that's something I'm passionate about. So I would say you need to expand your horizon, you need to basically expand your knowledge, you need to build your network, you need to be well informed. There is a lot of information out there, but most people make really dangerous mistakes just because of lack of awareness. There are lots of groups out there. If you do decide that you want to move out of the country, there are lots of groups out there regarding different countries and how best to attack them. So you want to ensure you have the right information, you're talking to the right people. And I would say with education and advancing your career, it's not something that you can do alone. So do not be scared to make friends, do not be scared to talk with your peers, to have that peer group to create that support system where you share your goals, you share your dreams. Within that support system, you would get a lot of advice, you would avoid mistakes that other people make, you would also get connection to meet the right people or access to the right resources. So definitely get that support system, share your dreams, and the sky is your limit. And for medical students that do decide to stay here, yes, we need you here in Nigeria. Nigeria is a country that has one of the lowest ratios of doctor to patient, so please do your best, but still train. I believe training is important even after medical school, just so that at each encounter with your patient, you're giving them the very best experience. So still train, get a residency, and give your patient the best. And I really like to say thank you to the government for the efforts that they've made so far. Some things are provided freely to patients, from contraceptives, vaccinations. That is really wonderful. And also the health awareness that they do in communities to ensure that especially mothers and children get access to these services is also a good thing. But there is still so much more that we can do. There is still so much advancement that we can do. Coming to Nigeria, I was asking, what do you do if someone has a heart attack? What do you do if someone has cardiac arrest? How much care can you really provide, even in the hospital setting, before we talk about outside? And it really is not a lot to save lives. So I believe the Nigerian government can do a lot in improving the facilities that we have in the hospitals, so that each patient gets a good chance at being alive before they leave. Thank you very much.